Hi, I'm Dr. Power with PowerMD, Anti-Aging and Aesthetic Medicine Clinic, located in Marin, California, just north of San Francisco. Today I'm going to demonstrate a technique to open up around the eye area and to make the eye area look brighter and more youthful and a little less tired. I'll be using a protocol where we will use a filler to fill any shadow, any deficit, and we'll use a neuro-Relaxer, Botox today, in order to smooth the eye area and prevent the fine lines that form during a squint or a smile. So we've got a patient model here. We've already treated one side. So if you notice here, there's a little smoothness. So on this side here, there's a deficit. There's a sort of an area that's a little bit more hollowed out, and that causes some shadowing here. This is caused by a couple of different processes. One, the eye socket or the eye area enlarges, so the bone actually moves aside a bit, and this area becomes hollow. There's also volume loss. As the skin area becomes a little bit thinner, you lose volume. There's also gravity, so the eye pad, the fat pad that's underneath the eye, slips down onto the cheek a little bit. You can actually sort of see that process here. Some people will also have a little bit of purple or bluish discoloration, and that's from venous congestion. It's actually the pigment from the blood cells as that area becomes a little bit puffy from drinking alcohol, from not getting enough sleep, or from allergies. Those are pretty common causes. You can also get some pigmentation from the sun, and that will actually increase any apparent look of shadows. So it's really a multi-pronged approach to brighten up that eye area and make it look more youthful again. On this side we've already treated, so we filled in the shadow with some filler, and that's going to help reflect light and smooth the entire area. So the light reflection really helps to sort of pull up that area. I also treated with the Botox, and that over time is going to sort of lift and open up this area. The Botox takes a few days to kick in, so we're not going to see that result for a bit. So now I'm going to match the work on this side and brighten up and open up this side of the eye. So I've already prepped the skin. Started off with lidocaine numbing cream with benzocaine, lidocaine, tetracaine, and that's going to numb the area. And then we cleaned it with alcohol. So go ahead and lean your head back, close your eyes, relax. I give my needle a little bend. Again, I'm using Restylane, which is a hyaluronic acid. Hyaluronic acid is a naturally occurring substance, a complex molecule that plumps the skin. So it gives a nice lift. So a little poke here. So we do bend, I bend the needle a bit just so I can go right underneath the skin. Do you want to go underneath the muscle in this area as well? So it's a little uncomfortable the first few injections. We need to go under the muscle so that the product looks smooth in this area. The skin's very thin and you don't want the product to show. There's a lot of mobility here, so you want to make sure that the product is beneath the muscle so it's anchored and doesn't move. There is lidocaine in the product, so the first few injections are a little uncomfortable, but then the skin numbs up pretty nicely. Okay. A little bit more product here, and you can right away see the skin lifting from underneath. You just see that shadow start to diminish as I slowly and gently inject the material underneath the muscle. It pushes it up and out. Now, I like to really concentrate on the outside of the eye area, the lateral area, especially in a man, because it's going to look a little more natural. If you overfill the shadows right here, sometimes it gives sort of a crinkly look and can actually make the eyes look a little smaller. That's hard to reverse with makeup in the case of a man, so really try to avoid making that happen. Okay. Women will often hide this area with a little concealer to give the illusion that the shadow is lifted, but men don't have that option, so really lifting the area with the filler is a better solution. Now, this product does last about a year in this area, so it does give a lasting effect. Pretty immediate and quite well lasting. It's going to swell up a little bit. The skin is thin and it is prone to swelling, but that'll only last for a couple of days and it'll be minimal. Okay, open up. Good, okay. Leave your eyes open for a minute so you can see how much smoother it is here. It's Still have a little bit of a deficit right here, but now it's very small instead of that large deficit. But I'm going to go in and fill here a little bit, but you have to keep your eyes open for this, please. Thanks. So you do, it's a little awkward for patients, especially the first time they've had the procedure done. But now it's a little bit numbed from the lidocaine that's already in there. All right, how you doing?
Good, good.
What are we doing with the eye open so I can really sort of see the landmarks at this point? So you see this little shadowing here, a little shadowing here. You also see these little lines across the side, little horizontal lines. Now those are really going to decrease and diminish when we use the neuro-relaxer, in this case Botox, which will soften the muscle contraction and smooth and open that area out. But that will take a while to kick in. That takes several days, so we're not going to be able to see that effect today. And there is a little bit of pigmentation here, a little sun damage, so the most important thing to do is to use sunscreen to make sure you get it all the way around here towards the sides of your eyes. We can also use an IPL photofacial laser to break down some of that pigment and give a really rapid clearing of that pigment, and then follow up with a good skincare regimen. I like to use hydroquinone 4%, which is a prescription strength bleaching cream. It'll lift some of that pigment out. And a little bit of retin-A or retinol, really low dose to start off because the skin is very sensitive. But that retin-A will help to tighten up this area and increase collagen synthesis. So a little bit more just to sort of smooth the area right here. And then we'll use the neuro-relaxer so that we won't get as much contraction of that muscle on the side. Softening this muscle contraction will also help that product stay put. It won't get driven out, and that will allow this effect to remain a little bit longer and really help you keep your benefit. Okay, a little poke right here. Now the patient's a little numb from the lidocaine that was in the product, so that makes these injections very easy. Smile and squint for me. Good. So we watch to see where the patient gets the lines, if it's below or above the midline, and then use the product accordingly. Okay. Give a little bit of a lift to the brow to bring it up out of the orbital rim. But we don't want to pop up the brows too high because that can be a little feminizing. So it's a balancing act on a man's face. Men typically have a very horizontal eyebrow, whereas women have a little bit more arch to their eyebrow naturally, and we very much try to retain that natural look. Just keep it looking youthful. One more right here, and we'll be done with this area. So there'll be some swelling for a couple of days. Again, it's just not going to look really smooth, but then after a couple of days, the Botox will kick in, the swelling will go away, and you have a nice smooth result. All right, thanks a lot.